So, hello, Dr. Matta.
Hi.
Thank you so much for hosting me today and inviting me here. So, I'm so excited. It's my first time to have a podcast with a doctor. So, you are the first doctor in the whole series.
Thank you for inviting me. I hope I can give you some answers which can help your viewers.
Yeah, a lot. I'm quite excited about this interview because I have no much knowledge when compared to you regarding the medical field and doctors. So I quite prepared and came today. So I got my questions so that I don't want to get mixed up with my questions.
Sure. This is first time giving a podcast, so let's see how it goes.
Sure. So let's just start with this part. How did your journey started from India to USA?
So, meaning it's a short story. It happened while I was in med school. I never thought big. All my ideas were very small. So once it's almost final days of my medical school, and I was telling one of my friend who actually has very big ideas.
Mhm.
So said that, oh, I'm going to buy a Maruti 800 as soon as I'm done with the med school. And he laughed. Being a doctor, you want to buy a Maruti 800?
Mhm.
Think big, then you will succeed. That's when he actually said idea that why don't you want to pursue your education in US? It might help you financially, and it's very good opportunity. So that's the day turned everything upside down.
Nice. What did you inspire to become a doctor in the first place?
So my idea of becoming doctor actually was implanted into my brain by my mother. So because she saw a lot of suffering, she lost a child when the baby was less than a year old, and when I was 5 months old, I got sick, and she couldn't be able to find a good care back in
1982.
Yep. So that's when she decided that I want my son to be a doctor so he can help others. So she implanted me. That idea grew with me. And as you know, in India, after 10th grade, you have to decide which way to go. So that's when I decided I wanted to go to the BIPC and go MSET and get to the medical school.
Mhm.
So it happened, actually. It took a lot of struggle, a lot of hard work, but I stick to it. And finally, I became a doctor.
Nice. It's an inspiring story. To get a more understanding of you, so 1982, and when you're telling 1982 itself, I can understand how the Medicare facilities back in those days used to be like. So in India, specifically, from which place are you from?
So I'm from very rural area called Kalidindi. That's actually my mom's birthplace. So
Okay.
we finally settled. My dad, he was a cop, and he was retired 15 years ago. So because he was a cop, we used to travel a lot. Every 2 years, he will be transferred to a new city. So during my childhood, I never stayed in one place for more than a couple of years. So that actually impacted my studies too. So my mom decided that I need to go to a hostel. Stability. So
Okay.
it's very important in life. Roaming around without any stability, without any view, you will not go far. You'll go in circles. So that's when, though we couldn't afford, but she made it happen. I think my mom played a very big role in my education.
That's so nice to hear. I can imagine all the struggles you have gone through. So, coming to the term struggles, so what are the most of struggles you faced in the process of becoming a doctor in India?
India population, it's a huge population. Now it's
Very
now world
huge.
number one, right, in terms of
Yes.
population. But we don't have much opportunities. To give you a contest, I took my MSET back in 1999.
Mm-hmm.
And there were almost 2 lakh people who wrote MSET. And I got the first time I got around 600, and I still couldn't get into the medical school. So I had to study for one more year, and then I got
So we call
60th.
it long term, right?
Yes. So
Okay.
one extra year just to crack the MSET, and I got 60 on it. So I was able to get a secure seat. So it's
Nice.
so competitive that even though you work hard, couple of questions make a big difference.
True.
So for 100th rank to the 600 rank, there are 3 or 4 questions. If you get those 3 or 4 questions wrong, you won't get in. So it's a huge struggle, a lot of stress, a lot of hard work, 16 hours a day
Mhm.
studies, but it paid off in the end. So and now the opportunities are getting better, but it was very hard. I think
Yeah.
even now, if you want to get a free seat, it's very hard. So it's all about
Competition and a lot of other.
less opportunities, more people. So you have to be the best to actually get into it.
Also, is there anyone else in your family who is a doctor, or did you get any
No.
support from your family?
Yeah, that's the thing. No one in my family were a doctor. And not even people who finished their degree. We didn't have enough in terms of what to do next.
Got
All
it.
we had is just a motivation. So if you don't study well,
I don't call it as a term called nepotism, but quite we usually hear that the children of doctors become doctors.
yes, back in India, that's true, but not here, because in India, you have your private hospital. So they spend so much money to build a hospital and so many years to build a reputation. That's very important in India. If you
Yeah.
don't have a reputation, whether it's 100 crore hospital, no one would go there.
Mhm.
So they build so much reputation and they spend a lot of money, time, everything. So they don't want to just let it go. So that's why they encourage their kids, at least one of their kids, to be a doctor so that they can continue their legacy, what they built. So that's
Yes.
why. But as I said, if you have money, you can buy a seat. That'll get you a seat. That's all. That won't make you a good doctor. So within 1 year, people will know what it makes you a doctor or not.
Got
So
it.
if you don't have that, obviously, even though it's 100 crore hospital, no one would go there.
I do agree that. So without having a doctor in the family, it's hard for you to become a doctor all by yourself.
Actually, now thinking back, yes. So this has to do with my MSET.
Mhm.
So when I got rank, so we need to register our rank to get to the counseling, and I didn't know it. No one told me that. And by the time I realized, it's past the deadline. So I actually missed once just because of that. Yes. So if you don't have someone who is actually has done it,
Mhm.
so you have to know everything by yourself. So you can know in detail everything. So you might miss a big opportunity, which I did, but things happen. I don't
But
regret.
still,
But
all the things fell into a right
yeah,
place.
yeah.
Once you completed your MBBS, people usually do PG. Did you do any there, or did you come to US directly?
No, actually, as I said, my friend inspired me to
Mhm.
come here. So the process begins there. Once you are done with med school, so you have option of doing post graduation in India or doing post graduation out of India. So
Okay. What I was about to ask,
yeah.
what is exactly the difference between post graduation in India and residency in US?
So I think the terminology is different
Mhm.
for post graduation.
Okay.
So in India, you get MBBS and then post graduation you become MD. Here, by the time you are done with med school, you'll get MD. So it's just a terminology difference.
Okay.
It'll be almost the same. It's the
Nice.
same 3 year program.
Good to hear that. How did your process of residency started here?
So because I didn't have much help from
Mhm.
my family, so
Mhm.
I had to rely mostly on my friends.
Okay.
The ones that actually helped me to be here. Like it's expensive to come here, stay here. So as soon as you're done with your medical school, you have 1 year of internship.
Mhm.
So usually it's better to start when you're in internship. Usually is
Internship in the sense back in
India. So
Okay.
you have to do 1 year. I
Okay.
think now government is asking them to do in the rural areas. But
Mhm.
when I was doing my med school, mandatory rural area. Now I think have to do 1 year in rural area.
Okay.
At 1 year, yes, you will work, but you should still have time. That's when most of the people prepare for the post graduation. So if you want to come to US, that's the first process. That's when you'll start studying for USMLE.
Mhm.
USMLE means United States Medical Licensing Exam.
Okay.
So what I was doing, it was actually total 4.
Mhm.
It's called step 1, step 2, CS, and step 3.
Okay.
So now they don't have CS. CS means clinical skills.
Mhm.
So that's interesting, but they removed it. So they want, because for doctors, we don't have to do GRE or TOEFL.
Oh,
We can just do the steps. And if you get a good percentile, you can for interview. You don't have to do the GRE or TOEFL for a doctor.
nice. This sounds like a good benefit to the doctors.
Yes, as instead of GRE TOEFL, we have
Mhm.
something called clinical skills.
Okay.
What it is, they have 12 patients,
Mhm.
pretend patients. They're not real patients.
Okay.
So they pretend as if they are sick. So you have to go talk to them, take their history, diagnose, and write the treatment plan.
Okay.
So like you are talking to them
This happens here in
in
US.
US.
Okay.
So I did it in Houston.
Houston.
Yeah, you do have the clinical skills. Most when I was in that process, most of the people from India failed in clinical skills because it's new accent.
Mhm.
Though we know English, the accent is so different that's hard to catch. So most of the people usually fail in the clinical skills. But
True.
luckily I went through. So
Yeah, when it comes to since like a doctor, the accent needs to match the people of USA living here.
yeah.
That might get some confusion in the.
So even now I get to have some patients who's they'll have difficulty understanding my accent. So
Okay.
I don't feel bad. Like I usually say, okay, if you don't understand, it's okay to ask me again. I can repeat it
Mhm.
slowly so that you can understand. So that's very important. Don't get offended if someone doesn't understand your accent.
Mhm.
So I'm from Andhra. So if I talk Telugu, can people from here understand? They don't,
No.
right? So it's okay. If they don't understand, it's okay to repeat. So we have the steps, and When I did, it was all percentiles. You had to have at least 99th percentile.
99th.
99th.
Sounds like a
Yes,
hard
because we have so many people applying all over the world, so they have to have something screening to screen out people.
Okay.
The first one they choose is scores. If you don't have 99 percentile, your chances of getting into the residency very less. Now I think the step one, they took out the percentiles. Now they're saying pass or fail. You go to the next step. From there again you have percentiles. Very competitive then, because most of the doctors from India wants to come to US, and we have
Yes.
less opportunities. And moreover, there is very few programs who will sponsor you a visa.
Got it. On which year did you come to US?
So, as I said, for clinical skills, I came to Texas in 2008. That was the first time.
Is it on your F1 visa?
No. So, back then, they used to give visitors visa, B1, B2. I applied for B1 and they gave for 6 months. I came here, I passed. Then, so usually they prefer some kind of hands-on experience here. So, what I used to have something called observership.
Okay.
Because we are not allowed to actually touch a patient
Okay.
without experience here in US.
Okay.
So what we can do is, if
What is HIPAA?
HIPAA is you don't have access to patient information at all.
Okay.
So if any age, sex, or whatever the drugs
All
they
the
are on,
demographics.
all the diagnosis. So that is all covered under HIPAA rule, where no one has access other than the treating physician.
Got it.
So we are not treating physicians, we are just students. So we don't have access. We cannot even talk to them.
Okay.
So what is something called observership? So you can be with the physician and take permission from the patient, saying that, oh, he's an observer. He's going to observe what the physician do here, how they treat. And if they say yes, so we can stay in the same room. If they refuse, we cannot even stay in their room. So I did that for 6 months.
Okay.
It was a lot of struggle to get into that, because there's so many people applying.
Yes.
So you have to be the best to actually get into it, or you need to know someone here to help you.
Okay.
And almost 3 years, though I finished my internship in 2008, by the time I got my residency, it was 2012.
So from 2008, were you on the B1, B2 visa, or did your visa status changed?
No, I was on B1, B2, but I didn't stay here for all the 3 years. Came back and forth.
Okay.
I can stay only for 6 months.
Yes.
So I came here, I gave my test, went back. Once I passed in Hyderabad,
Okay.
I used to do night shifts, and during the day I used to study. And then again came here, because step 3 you have to give here. Step 1 and step 2 you can do it from India. Step 3 you have to give it here in US.
Okay. Is it the USMLE examination?
Yes, that's step 3. It's called step 1, step 2, step 3.
Okay.
So we had to give it here. So I came here, gave my step 3, and I stayed here for 4 months.
Okay.
That's when I was lucky to get 1 month of observership.
Okay.
Out of those 4 months. So I did 1 month. That's in Mount Sinai in New York City.
Okay.
That's when I did the interviews. So it's very competitive here.
Okay.
And moreover, as I said, you need to have 99 percentile. Even 1% less than that, you will be screened out. So you need to know someone. Even though you're good, doesn't mean that you'll get 99% all the time.
Okay.
So I had some help. A word was putting in, and then they'll call for interviews. I applied for 3 years continuously. Gave up. But my friend, who was the one who inspired me, said, give one more try, the final try. I won't ask you again. But you have to look at the parents' finances.
Yes.
So I said, okay, I'll come, but I cannot stay for more than 1 month. So I'll see whatever the interviews I get. I'll schedule it in that 1 month. Luckily, it went the day I got the result.
So where did you give your step 3 examination?
In New York City, One Plaza. So I gave up on the dream of American doctor. So I gave some exams back in India. So I got selected. I was going for, that's when I got a message saying that I got matched here.
Nice. So that's how you landed up in USA.
Yeah, it's just a lot of persistence and hard work. Most of the people see the doctors after they are done all this hard work. For engineers, you have a fun life and then you struggle with the stress and anxiety for work. For doctors, we struggle initially, then we have better life.
We are letting our audience know all the silent work before you become success. All the quiet hard work, all the inside struggles you face through.
You might imagine there'll be 2 lakh people inspiring to be a doctor. In the end, you'll have 100. So what happened to that 9,900,000 people?
So finally, you landed up in US. Again, after your examination, did you start working back in New York?
After you get selected, we have our residency for 3 years. So the first year is brutal. Yes, in India, much more brutal than here. In India, we used to do the 36-hour schedule. So we come this morning and we go next day evening, no sleep, nothing. We just stay in the hospital. Okay. And the next day again, you have to come back. So you have only 12-hour gap every 36 hours.
Okay.
Lack of sleep, stress, people were making mistakes. So then they restricted to 80 hours a week.
Okay.
So when I came to do the residency, we were doing 80 hours a week.
80 hours a week in US
In
too.
US, even now, it's so every resident will have to do 80 hours a week.
But still, all these 80 hours of hard work which you pay or which you work here in US is not known to all the people out there.
No, that's what they think. Oh, it's easy. It's not easy to be like the first year is much brutal because we don't know the language, but not the people. You have to interact with them. So back in India, you sit, patient come to you.
Nice.
In here, you go to the patient doesn't come to you. So we have to document each and everything here.
Okay.
So it takes a lot of time. Though it's 80 hours, technically we do 100 hours a week because you have to document everything what you did. So they made sure that we have at least one 24-hour in week which are off. So that 24-hour can be from to the evening to next day evening. Again, you can have to do the night shift.
Okay.
Yeah, it was pretty tiring.
Well, hearing your journey from India to USA is awe-inspiring.
Yeah, now looking back, I feel like is it me
all
that I did?
nostalgia for you right now?
Yeah, I know, because trained to do hard work back in India because we have seen and it became a norm. People who don't do that, and for them it looks like, what, you did 80 hours a week? How did you even do it? If you take 10 hours, still you won't, because one day you had to have off, so you have only 60, but you had to do 80. So we do 12-hour shifts from 7 to 7.
Nice.
And we stay until 9 to finish off our work. So it's technically 7, but 9 o'clock. And I used to live 1 hour away. So it's technically 14 hours for me per day.
Oh my God. It's, quite racking up like anything.
So first mentally prepare yourself. Okay, this is what I'm going to do for the next 30, 40 years of my life. Will I be doing this? No, I cannot. Then don't even come this way, because if you don't enjoy what you're working, it's not just being a doctor, being anything, right? If you want to be a businessman, if you don't think that you're going to do this for your rest of your life, don't get into it. You'll be wasting time, money.
Here we end our first segment. Good to hear about the journey from India to USA. So shivering out here.
Yeah,
Let's shift to a different place.
Yep.
And it's a great start.
Okay.
Yep. Dr. Matta, we are here at a new place, but still it's raining today.
It is, but kids...
Yeah, I see. You're enjoying with the kids also.
I know. Kids doesn't have rain, snow, sun. It doesn't matter. They always want to play.
Well, at this point, I was about to ask you how a day in the life of a doctor will go, but I'm seeing in live right now.
So most of the doctors, they do get a couple of weekends they might have to work, but most of the weekends they do get off. And a regular pediatrician who covers the hospitals, the day starts around 7ish. So usually we go to the newborn nursery, because we are pediatrician, we cover all nursery too. So we go to the nursery, we take care of the babies who are born overnight or the previous day, and take care of them. And if there is any discharge, we discharge the babies, and then we start our outdoor outpatient around 8 o'clock. So it starts from 8 until noon, and then we'll get a break for 1 hour. So usually, depending upon how busy, we'll see anywhere close to 4 patients per hour. So we'll be scheduled at least for around 12 patients in the morning and maybe 15 in the evening. So depending upon the schedule.
So in a usual day, you treat max.
So depend. This is my second job where I'm right now. So this is a little hectic. I see around close to 30.
Close to 30 in a day?
Yes.
Won't that be hectic?
It is, but this is 10-hour job. So there we have option of doing 8 hours a day or 10 hours a day. So I choose to do 10 hours a day so that I can get extra one day where I can get to spend time with the kids.
Also checking up on this, usually what kind of cases do you attend?
Being a pediatrician, I see babies from newborn until 21 years of age. Most of the times will be annual physicals for kids who are getting into the school, and those are called well child visits. So every kid will be seen at least once a year during the school age period. Before that, they'll be seen more often. And then we'll have some sick visits where they tend to get sick, like sinus infections, ear infections, throat infections, pneumonias, urine infections. So those are acute visits. We do sometimes get very sick kids where in our clinic right now where I'm working doesn't have hospital affiliated, so we have to transfer them to the emergency room. But the previous hospital where I worked, we have an inpatient. So if there is any sick, I do admit them directly to the hospital and take care of them in hospital in the inpatient setting. But
Okay.
right now where I'm working is only outpatient setting.
Oh, got it. How do you manage between the tough cases and the joyful ones?
Obviously, annual physicals and well child visits are a bit easy, but obviously it takes time because you have to do the head to toe examination.
Mm-hmm.
The sick kids, so most of the times we tend to focus on what exactly the issue for that day to
Mm-hmm.
make sure that they are safe.
Mm-hmm.
And yes, sometimes we might have to cancel other patients to actually accommodate some sick kids. If there's annual checks and if they're running late, we call them and say, hey, don't come. We're busy today. We reschedule to the next day.
Mm-hmm.
And if at all, if it's getting too busy where we don't have enough time to see, because it's our group practice, the other physicians step in to take care of the ones that needs to be seen by me if I'm taking care of a sick kid. So we work together. So if you have an inpatient, that's when it gets tricky. If you're a sick kid and if you are the one who's supposed to cover, so you will be going to the hospital, so all your patients will be stranded. So one of the other providers will step in and take care of their patients. If they want to see me only, then we have to reschedule for the next day or for the next week whenever there's an appointment available.
Nice. As a pediatrician, this is one fun question. Whenever you're attending kids or the children, do you find it stressful or stress relief?
It depends. If they're smiling, it'll be very easy. If they're cranky, obviously toddlers up to 1 year, they're all happy babies. So it's easy unless they are sick.
Mm-hmm.
But toddlers like 2 and 3,
Mm-hmm.
they know that it's not naughty. They know when they come to the doctors, they get a shots. So they're scared of the shots. So that's why I don't even wear any white coat. So because I don't want to scare them off. As soon as they see the white coat, they get scared. So most of the pediatricians don't like to wear the white coats just because of this reason.
Nice. When it's coming to your daily life as being a pediatrician, how do you unwind a day?
So I guess everyone is different. For me, when I'm done with my work, I try to forget what happened the whole day and come home with an empty mind so that I can spend more time with my kids rather than thinking about what I had seen through the day. Obviously, there will be some days where I'll be worried about that kid who I transfer to the emergency room or an inpatient. I call on, check to make sure they're okay. Most of the times, I call the on-call because we won't be on call every day. Previous hospital, I used to be every third day on call. So on call means whatever the time, doesn't matter. You have to go to the hospital when they call you. So whoever is on call, I try to give them heads up and say, hey, I'm admitting so and so. These are the things that you should be looking for. If you have any questions, give me a call, something like that, so that we can sleep through the night. Or else you won't get sleep if you keep thinking about this patient.
Nice. One more quick question. So how do you manage your work-life balance?
So as I said, right now I wanted to do 10 hours a day. Yes, that one day would be so hectic seeing 30 patients a day, but at least I get one day off where I get all the time to spend with my kids, right? So
I see how you are spending time with the kids here.
On the weekends, as I said, not all weekends will be on call. So what are the weekends I'm not on call, or what are the weekends I'm not working? Because sometimes we work on the weekends too. Those are the weekends I try to spend every minute with them. So for compensation for most of the days that I don't spend. But most of the times we do get a lot of time. So this is the main difference that I see from India. In India, most of the people, they own their own hospitals. So they are on call 24 hours a day, 7 days a week. It's very hard for them to take a day off because it's their own hospital. So who's going to cover for them? So they have to request someone else to cover their hospital. And most of the patients won't like it because they are here for that doctor. And if they say, hey, I need to take an off because I need to spend time with the kids, it doesn't go well. So that's why in India, work-life balance is so difficult. Here, it's like a group, so it's easier, and patient don't mind if someone is covering for the other doctor.
Yes. And I have a surprise for you. I have a companion with me. He's a very young kid and who is aspiring to become a doctor. And she has some good questions for you.
Welcome.
Yes.
Let me see what kind of questions she has and how can I help her.
I'm Shritika and I'm in 9th grade and I want to go in the medical field, so I have a few questions.
Sure.
So what suggestions do you have for students who aspire to be doctors?
Initially, if you can see yourself working in this medical field for the next 30, 40 years and you don't feel like you're working too hard or you can't do this anymore, try not to get into it. So this field, yes, you'll be working long hours. You might be stressful. So this is part of the life. The first thing is you should see if you can do this or not. Once you decide that you can, then don't look back. You will come across a lot of hurdles. You don't give up. You have to just go through it, and once you're through and through, then it becomes a part of life, and that stress and all that will become part of life. You won't have issues. So first thing is, make up your mind. If you want to come, then don't deviate, just go ahead with it.
How do you think AI will affect your profession in the future?
So yes, even we are using AI right now. So as of now, I think it's not going to affect so much in terms of job security, if that's what you're worried about. What I see AI can do is, it can help to be more productive. Meaning, right now I'm seeing 30 patients a day, but most of the time I spend writing the notes and evaluating and then diagnosing. Right. So that part, the writing part, the conversation part, everything will be taken over by AI, which can do the notes for me, and I can give the diagnosis, and it gives me the treatment plan. So most of the time, it might make me more productive, and it might help me make less mistakes. But maybe future, right now we're doing something called telemedicine, so it might affect in terms of how many physicians will be working. Meaning, right now our group consists of 10 providers. So then with the AI, because it increases the productivity, we might need only 5 providers instead of 10 providers, right? So you might lose that 5 jobs, but I don't think it's going to replace the whole. At least it will concise and make it better. But obviously, the lost here is job gained somewhere else. So I think that's how it's going to work.
Currently, there's a lot of students who want to become doctors, but there's not that many physicians. Do you have any alternative professions that they could?
Yes, so definitely. So for being a provider, you don't have to be MD, right? So you have something called physician assistants, you have nurse practitioners, right? So yes, becoming a MD, it's a very long process. So 4 years of pre-med, 4 years of med school, 3 years of residency, and 3 years of fellowship, right? So total 15 years. It's almost like you getting into the kindergarten and getting out as a 12th grader, right? So it's a very long process, right? Does provider need that much specialization? Maybe not. Meaning, primary care, you don't need that 15 years of, what is that, the medical school and stuff, to actually become a primary care. Maybe by doing a physician assistant or nurse practitioner, you can cover most of the primary cares. Yes, specialties you need that MDs, but for primary care, as of now, if you want to settle with the primary care, nurse practitioner is very good. And it's not just this primary care physician doesn't has to be only medical. There are mental health, right? Behavioral health, psychology, psychiatry, and then again, if you go into other medical fields like speech therapy, physical therapy, and if you go into occupational therapy, right? So there are so many fields in the medical which we need help, right? So people who doesn't want long hours or long time to go through it, or who cannot spend so much money, because obviously it's expensive to become a doctor. So there are so many other options. These are all very viable as of now, and I don't think any of this will be replaced by AI. Let's take for physical therapy. AI will maybe help you say what kind of exercise you have to do for so and so injury, but it won't do it. So you have to do it. So physical therapy, I don't see the AI replacing the physical therapy. Speech therapy, right? Most of the speech therapy, you have to tell the baby or the kid how to talk. All it can show is just a video. It's like watching a TV, and they will have fun watching TV. They won't learn, right? So those are the things. There's so many other fields in the medical itself that you can get, which definitely have a good job security, which won't be replaced by AI. And in terms of income, yes, you will have good income, but depending upon how many hours you're working. So there's so many things that you can explore. It's not just the being a doctor.
Thank you.
You're welcome.
So, Dr. Matta, we have completed a good number of segments. We have seen how you started from India and came to here. Moving forward, let's talk about investments.
Sure.
Initially, how much did you invest to start this career as a doctor in the USA?
To become a doctor back in India, it didn't cost me much, because I got through the MSET and got a good rank, and then didn't spend much other than the regular needs. I guess maybe a 30 to 40,000 per year. So that turned out to be maybe a couple of lakhs. So it wasn't the expensive part. Even here, the residency is actually, they pay you. So the only expenses is actually what in between, how much time you take, how many times you attempt. So that's the most important part. So to come here and to go back, so I did almost 3 times. So
Okay.
that costed me around 3 lakh rupees. And then applications, I did 3 times. So each time I applied for close to 100 programs. So each program costs you money. So that itself costed me a couple of lakhs each time. So on an average, I think maybe I spent around 10 to 15 lakhs, maybe. That too because my friends helped me with my stay and food. If it was me who's spending money on the food and the shelter, it would have been close to 25 to 30 lakhs. So that's
True.
why support definitely helps. Yeah.
Yes.
So if you have someone here who can take care of the at least shelter and food, it's going to be a little less expensive. But if you're on by yourself, where you have to spend everything from your pocket, could be a little expensive. Now with the inflation, I would think if it's in first attempt, if you get it, you might spend maybe 15, 20 lakhs. But if you have to come couple of times and spend a few months doing observership, then you might close to
34 lakhs. Cool. How are your finances look like in the first 2 years when you came here to USA?
So the residency, they don't pay you much, but they pay you enough for your food and shelter. So they paid, I think, close to 60 or 55 to 60K per year. I did my residency in Manhattan. It's very expensive to stay, and
Yeah,
each studio costs at
Manhattan.
least couple of thousand. Well, I couldn't afford that much.
Studio
So
is just one bedroom and it directly connects to the
yep.
hall, right?
Still, that's very expensive in Manhattan. So I actually lived in Bronx, which is 1 hour away from where I worked. So that costed me 10,000 to 1100, much better than Manhattan, exactly half of the price. So I was able to afford that and then travel with a subway. I didn't make much money first 3 years when I'm doing my residency, but I still actually made. I don't know whether it's by luck or maybe by I don't know much about retirement plans here. So they offered me 401k. I don't even know what exactly 401k means. But I thought they said they're going to take out pre-tax money, so I don't have to pay the taxes. So I thought that's a good thing. And then I just put it in. And later on, I realized what it is. But at least for the first 3 years, that was the only investment I did. But yes, finances is very important, right? Being a doctor, you serve patients, you earn money. What do you do with the money is very important. What do you want to do with the rest of your life? That depends upon what you're spending and how much are you investing. So I realized very late. I would say I should have started investing in 2012 when I came in, but I didn't know much. Most of the doctors doesn't know much because we focus on so much on the studies. We don't take care of the finances. So then with my friend who is always with me, he suggested me to actually do a financial course to actually understand what finances are. Initially, I refused, but I said, why not? And it made me a very good insight. At least what things you should not do as a finance in finances. Financial mistakes, right? Those will be very costly. Whether you invest or not, if you keep saving, you might have some money. But if you do a financial mistakes, your all wealth will be wiped out. So that gave me really good insight into how investing works, what to do for investing. So that helped me to actually make good amount of money passively. So actively I'm making money, but passive investment is very important. So all I do is stocks and bonds.
Also, can you give a hint of a salary structure for a pediatrician on comparing it to the other specialties?
Yes. So depending upon where you're working and what you're doing is very important. Meaning, the first job I worked in a very rural hospital where there are not much, no other providers available, and there's only one hospital. So I'm doing the inpatient emergency room and C-section coverage, nursery coverage, and outpatient. So I have so many responsibilities. Yes, that's why they paid more, almost 250K plus a year. But now I'm because of family situations, I have to move, and this one I do only outpatient. So I don't do any inpatient anymore. So outpatient they pay you 200K, and specialty depending upon which specialty you are in. So how demanding it is. So it'll be paid at least 250 to 300K minimum.
250 to 300K. That's a good range. Also, for the people, whoever is watching, for the viewers and the audience, or the aspiring doctors who are thinking to come to USA and start their career, what do you suggest them about the finances?
Obviously, don't think too much about finances in the early. As soon as you get your residency, that's when you can start thinking about finances. And all you do is try to invest in something. Don't just keep your money in your bank, it will never grow. And Warren Buffett says, if the money is not working for you, you will never retire. You have to work for your life. Take that mantra, follow it, keep investing monthly, quarterly, or yearly, whatever you feel like, and whatever the money you earn. As per studies, they said at least 50% has to be saved. Some say up to 75. Start with 10, 20, keep going up to at least 50, and that will make you wealth, a lot of wealth. Always spend less than you earn. That's remember, debt is not good. Debt always kills the wealth. So always spend less than you earn, at least 50% less than you earn. If you earn 100, spend 50. Save and invest the rest of the 50. If you're young, invest the whole. If you're old, close to the retirement, invest less and save more.
That's such an informational thing. Even not just doctors, everyone should follow this.
Yes, definitely. Everyone should follow. Spend less than you earn. That's very important. Try not to borrow, means you're taking money from your future self. If you're trying to take money from future self, your future self will not have any money left. Try not to go debt. There are some good debts like mortgages, because obviously no one can save so much money and buy a house in cash. If you can do it, that's good. If not, that's the only debt I would recommend that you have. Everything else, get rid of it.
Thank you. Thank you so much for the wise information.
You're welcome.
Hello, Dr. Matta. Let's do the rapid fire round.
Let's go.
I will just ask you some quick questions. Answer them and try to answer them under 5 seconds. Chai or coffee?
Coffee.
Bollywood or Tollywood?
Hollywood.
Indian traffic or US snow?
Yes, no.
Stethoscope or otoscope?
Stethoscope.
What is your most favorite food item which you can eat all the day?
All day, maybe biryani. I'm foodie actually, so I eat all kinds of things. No.
What is that one app which you use the most?
WhatsApp.
So doctors do use WhatsApp more?
No, to call my mom and dad.
What is that one big investment you made in US?
I buy ETFs, so that's my biggest investment. ETFs, S&P 500.
What is that one dream you are aiming for the next year?
Usually I have a long-term view. I want to retire by 55, so let's hope that'll happen.
One word that describes your journey.
Struggle.
What is the secret of your success?
I guess there are no secrets for success. So you do your work. Sometimes, yes, you'll get what you want. Sometimes you might not. But you have to keep doing what you're doing. And there is no secret for success.
Thank you so much, Dr. Matta, for your
Yeah.
time and your whole day.
Thank you.
So, at the end, all I would like to ask you is, for the viewers or for the young Indian practitioners who wish to come and practice whatever the specialty they want in US, just give them one message.
So for me, all I think is make sure that you know what you're doing and make sure that you understand why you're doing it, and you should start liking what you're doing. If you don't do any of this, it's going to be very hard, because it's not that you can switch a career in between. Once you get into this boat, you are going to go in this boat until you're done. If you get out of the boat, there's not many options left. Yes, you can go to the business and stuff, but you are here to help someone. So you make yourself that you can do it and you will do it, and try to start liking the job. Yes, it can be stressful sometimes. Sometimes you feel like giving up. Just hold on to it. And once you go through that hurdle, you'll have a smooth sail, at least for some time. Again, you'll have an hurdle. So life is like that. You'll start having lots and lots of hurdles. You just go through one and get to the next one. That's how life is. But keep enjoying what you're doing. You will definitely do very well in your life.
Thank you.
Thank you. Bye,
Good night.
everyone.